My name is Kate Burton. I have the pleasure of being a staff VP in the digital care delivery team at Anthem. By background, I'm actually a drug discoverer, spent a lot of time in pharma and then worked my way through the healthcare business. And now I head up a group that not only has set up Anthem's digital incubator, but I work on strategic projects in the virtual health group. So very happy to be having this discussion with Alan today.
My name is Alan Murray. Like Kate, I also have a quite funny accent for somebody who is the president and CEO of Empire Blue Cross Blue Shield. And we are the largest health plan here in New York. All in, we cover about 5.2 million members. So it's about 20% of New York's population. By way of background, I actually started my career here at Empire back in 2002, at least my healthcare career. Before that, I was actually an officer in the British Merchant Marines. And I went to United Healthcare afterwards, and then I had the pleasure of starting my own health insurance company here in Long Island in downstate New York. And then I came full circle and back to Empire Blue Cross Blue Shield as the president and CEO about 2 years ago. So it's great to be here. Also, I've done quite a bit of work with advising some venture capital and a number of startup technology companies in the healthcare space. So I'm really excited to be here with you, Kate.
Yeah, I did not actually know that about the VC advising. I might actually ping you afterwards and you can help us with some of the startups in the incubator. And right now I'm actually residing in California, but in a prior life I was actually based in Manhattan running things there. So it's great to be talking to you. So speaking about sort of what's been going on in sort of New York City and also New York State, as the president of Blue Cross Blue Shield, what have you actually observed recently in the healthcare system? It's been a year or two since I've been there, but what's top of mind for you if you think about what's going on?
Yeah, I mean, I think it's a tale of two cities, like pre and post pandemic. So, I would say pre-pandemic, I'd come back to Empire watching from the sidelines. And to be quite frank, I think as a health insurance company here in New York, we had kind of found ourselves sitting in as a commodity. You have us, you have our competitors, United Healthcare, Cigna, Aetna, and we hadn't necessarily done a great job of differentiating ourselves. If I went to a finalist meeting and we went through quotes, it became a lot more about pricing as opposed to capabilities and technology. And so one of the things that I really wanted to focus on first and foremost was what is our purpose, right? And what are we going to actually do as a company vis-a-vis what our competitors are doing? And that's when I introduced with the team our new mission, which is to materially and measurably improve the health of all New Yorkers by 2025, right? So that's a pretty big and bold mission. But the way I feel is if we can't do it, then who can, right? And it's not necessarily that Empire and our parent Anthem are going to figure out everything on our own. We really become an enabler, a catalyst. And whether that's directly or whether it's in partnership with third parties, whether it's in partnership with our provider partners, we're introducing ourselves as the whole health company because we have all these capabilities from dental to vision to life, disability, accident, pharmacy, as well as the health insurance, the medical that most people are aware of. And as you know, Kate, all these incredible technologies that we're bringing online now.
Yeah, I think you made a really important point there that sometimes before people were talking about the cost, but I think in this new world when COVID struck, it was like, can you just even do it? I don't even care what it costs. I need my healthcare now, and how are you actually going to enable that for people in a whole totally different paradigm? So it sounds like the mission that you set out for the team, you kind of knew that COVID was coming. So speaking of,
I wish I knew that was coming. I think we would have been even more prepared, but it definitely gave us the right beginning, right? I mean, we had spent probably the better part of 12 to 18 months preparing to be a different company. So when COVID hit, we had the leadership team in. We'd already had a number of other factors ready to go. Nobody's really prepared, but I think we were probably better situated than most.
Okay. So from being situated well, that you think about initially telehealth, and that was like the first thing that people had to go to because otherwise they run the risk going into an establishment. So what were the sort of clear needs that you've seen there in recent months? Because that's where I spend a lot of time, my thinking, not only like what I want to bring into the incubator, but actually how I can help Anthem from a core strategy and develop certain products.
Yeah, I think, and I hope we're going to spend quite a bit of time talking about this because I think both from a theoretical perspective and a practical perspective, telehealth is in telemedicine, and I think of the two slightly differently, right? I think telehealth is, your teledoc, your live health online, you're looking for some sort of urgent situation, and you go on to one of these systems. Usually you have one with your health insurance, and you get the next available physician. You get on, you have a runny nose, you have, some sort of infection, and you have an episode, but it tends to be a different physician each time. It's different for obviously behavioral health, which we can talk about. Whereas I think telemedicine is you have an ongoing course of treatment, an ongoing relationship with a specific provider or provider group, and you find a way through telemedicine, either their own tool or some other mechanism to interact with them. So I think it's an interesting differentiator between those two, because the way we interact, I think, as a society was very different and continues to be different going forward. I still feel up until pre-pandemic, we were in a world where people knew about telemedicine and telehealth, but you know what? That wasn't the way they access care, right? They still got on the phone, they made an appointment with their PCP or with their specialist, they would go and wait in the waiting room because that's what we were used to as a society. And I think our adoption of telehealth, telemedicine was in the extremely low single digits. Yeah. We all know that is, there is no charts that reflect how quickly that's changed because we've been forced to. And I think now people are understanding, this is actually a really, really convenient way to get care. I don't have to get in a car and drive 20 minutes. I don't have to sit in a physician's office. I can have this interaction. And so I think that I've actually called it a revolution, an awakening to the technology of telemedicine and telehealth. It's definitely here to stay. The question is, how do we now enable it in order to learn from what's happened and improve it going forward?
Yeah, I think you made a good point that, not that all your points aren't great, but the first one, like telehealth before, was like a moment in time where I have a quite impersonal interaction with a doctor I'm probably never going to see again because I have an immediate need. And now it's turned into, actually my healthcare could actually be delivered digitally first. So it's more talking about virtual health rather than telehealth, and how do we support virtual health for a primary care physician. So that actually becomes the first way they do it. A behavioral health, and how do you support virtual health in the home? So I know that's how we're beginning to take it, going from that telehealth one moment in time interaction to virtual has to come first, or it should at least be thought of first, because it also has a bunch of cost implications too. Doing things virtually can actually decrease the cost. So glad we're agreeing on that one. So when it comes to the capabilities for serving virtual health, do you feel like I know I've got an idea from sort of central office, the things that we're trying to develop, but do you feel like you've got everything to handle? What are the top of mind things that you're looking to bring in or you see the need for?
Yeah, it's a great question. And I often think about it I think there's three different ways of looking at virtual telemedicine, telehealth. There's three kind of audiences, right? There's the payer audience. And so what is it that we're trying to do? And we want to be the front door, right? We believe that we have the connections with the providers, with the technology, with the benefits, with our clients, regardless of what your funding state is, whether it's Medicare, Medicaid, et cetera. And we want to be that front door. A physician, though, they want to, in essence, be the coordinator of care. And so what goes into virtual health from a physician's perspective? You have not just the interaction, whether it's Zoom or some other mechanism, but you also have all these devices out there now too. So whether it's cardiac monitoring or diabetic monitoring or fall monitoring, how do you make sure those are connected into their virtual experience so that that physician on the other end of it is looking at a set of information that they feel is associated with their patient? And then you have the patient experience. How do they understand the kind of inverse of that? How do I wear the variables? How do I make sure I'm taking my medication? How do I interact with that physician? And so from my perspective, I think the challenge we have going forward is twofold. Number one is ease of use. How do we educate people on it? And how do we make sure that there's not too much so the barriers become too great for people to adopt it, they don't revert backwards. And as a result of that, there's a lot of noise, right? There's a lot of, especially as we're thinking of the audience today with the technology, we have a lot of people competing for almost the same thing. And it kind of who differentiates themselves, who stands out, how do you distribute that to the physician so you can get scale? So that's, I think that's the next stage of the virtual health.
Yeah, that's a lot, because I know we do want to be sort of the front door, and I think we do actually have that capability to, but we also have to recognize there's so many other people also want a say in how the care gets delivered, and we've kind of touched upon this before. It's like the interoperability. Like, we might think a certain mechanism is the right way to go. Like, we've got our whole telehealth service, we've got Sydney Care, we want different RPM solutions to plug into that, but we also have to consider if people have got bring your own devices, or the provider have a certain analytics software that they want to use with certain devices as well. So it makes it quite complicated about what gets plugged in where. I know we have thoughts on our end of trying to bring in the technology which we think is going to be broadly compatible on a platform that we might be willing to give to the provider for free. But at the moment, there's a lot of work going on at the moment to actually understand what the provider wants. Like, we can't do this in a vacuum. And I think more so maybe than prior to COVID, we've got to have a lot more conversations of, okay, the payer thinks this is a good idea, but what does the provider also want? And then spend a lot of time talking to the patient, because some of the patients, I think, aren't even comfortable in this space at the moment. So we need to listen to them and like get them comfortable too. So there's lots of different people.
You know, Kate, I also think we have to be aware as a payer that a patient is likely to have multiple different insurance carriers during a relatively short period of their life, but most likely the same providers. Mm-hmm. And so operability also means that as they transition, you want to be able to accept the patient into your insurance with minimal barriers to entry for that, and also let them go and experience what happens when they leave, hopefully so they can come back to us because they know they're getting the best experience from us. So I think it's also really important from an interoperability perspective that we ensure that the physician's office doesn't end up having to use different solutions for different payers, because that in essence impacts their ability to both communicate but also understand the size and scale of all the things they're working with.
Yep, I thoroughly agree with you. And I know the work that we're doing at Anthem at the moment, we're doing a lot of research to determine what are people currently using. Do they still like it? Can we just add or augment to that? Because who actually wants to implement a whole new EHR system? I don't know anyone that's put their hand up saying, yes, please. So we need to be very thoughtful. And there's a big difference between what you can do and what you should be doing. And you need to find the right places to sort of intervene and bring in the technology. And I think you raise a good point about like who's actually paying for it. I think in some cases now you might see patients themselves deciding to sort of personally pay for things if they actually decide that that's best for them. And it's easier because like we haven't touched on it yet, like how you're going to be compensated for some of this, like do the providers even know? And in some cases, I know me, if I need a certain level of care for me or my child, I might go and just do it myself. And you've got to be able to grab the data for that interaction and plug it into the rest of the records if you want to be able to do this predictive analytics and work out what's happening in the future too.
Yeah, and I think that in of itself is a fascinating conversation too. I'm probably behind 99% of the people watching, as I only got my iWatch about 4 weeks ago. But as I begin to experience the data and technology it has, it's a real wake-up call for me as well when you think about all these different components of our life that have data monitoring the Internet of Things that give us the capacity to be in understanding the social aspects of health, right? So as we begin thinking about that too, you know, there's a lot of evidence out there that only 20% of what we do for a patient's health is based on medicine, right? Actually keeping them healthy, then going to the physician. What about the other 80%? And so for those out there, how do you integrate the Internet of Things and the devices so that we can also focus on the upstream impact, the society aspect of health as well? So it's a very broad conversation, but the interoperability of that and the removal of the noise, I think, is probably the next biggest challenge.
Yeah, and I think I thoroughly agree with you. I spend a lot of time, and it sounds like you've got the experience too, I spend a lot of time looking at the different pieces of technology and what they can actually do. And I think a payer has a role and actually a responsibility to help the patient say, okay, you've got all this data, you're determining you're going to collect it through certain devices of your own. Here's the ones we suggest. And that data is very valuable, but it's also very dangerous. So let us help you with it and make sure that it's being used appropriately, because I'm sure I could track a bunch of stuff with my phone, but do I actually know the appropriate thing to be doing with it? hopefully an AI algorithm could tell me, but we still need to see. But there's definitely a role for us to play in that one, and we're still working out, but actively asking. I know I'm spending a lot of time talking to providers and asking them what they think as well, because we really do need the clinicians' input on the sort of the safe use of data, no matter how it's actually being collected.
Yeah, I agree, and I think both Anthem and health plans in general and providers, the challenge of too much data is probably just as complicated as not having enough. I think there's a tendency to believe that if we give the patient the data, they'll understand it and do the right thing. And I think, and listen, I'm married, and I probably use my wife as the example way too much, and our friends. At the end of the day, I think most people want to be told, how to interpret the data and what to do about it, and then they can make the decision. There's a lot of data out there, and it is at times very difficult to make decisions, which is why we rely so heavily on our physician relationships, right? From a personnel perspective, because that's what they're trained and it's appropriate to do. But we also live in the world where you might get your medical advice from Facebook, right, or from WebMD or Google, and I think that when you combine it with the data from the iPhone and from the Apple Watch, could be just as dangerous without the ability for us to understand and provide people that guidance.
Mm-hmm. Yeah, I think sort of you could say that maybe Facebook isn't the best place to get data, but it's or not data, but influence. But it's true, and it happens. And most people do go to Google and WebMD before they even plug into a telehealth or a virtual system. I know my children will come down and self-diagnose themselves even if they've got a sniffle because they've seen something on the internet. So we can't control that. But I think what the payer's role is in partnership with the providers and education with the patient is to make sure that we've got an awareness of what they're all plugging into and kind of educate them on the way. It sounds like a lot to do, but definitely up for the challenge. And I know at Anthem, we're trying to say that we're digital first, and we're kind of acknowledge that is the way things are going, and we need to be there as a supportive partner rather than kind of like trying to tell people what to do.
Okay, maybe I can ask you then, with all that in mind, where do you see Anthem's digital vision? I mean, how does that interact with the way, both what we're learning through the pandemic, but also some of these other kind of social aspects which are going on right now?
So I would say, not to get too descriptive, but there was the in-person care, right? And then you can go all the way to digital, which is almost like a person's management of their wellness and everything else. And then in between is the virtual. And so I would say from an Anthem perspective, we're not going to go straight from in-person care straight over to digital and wellness. There's actually a large role for that virtual care to play. And I've kind of touched on it before. We see it as thinking about what's your primary care, because that's usually the first thing that people need is like interaction with their primary care. And then because of the COVID status at the moment, behavioral health, the importance of that is was so important before, now has just become more so. So that's another large part. And then we also do see sort of the management of chronic care, because there's been so much emphasis at the moment, I think, on diagnosing the virus, that you've got the walking well that are soon going to be sick because they haven't actually had their regular checkups. That's going to become a problem. So we're thinking about the chronic care management that maybe hasn't been sort of the priority of the last 6 months, but it's going to be. So did someone go and get their mammogram? No, maybe they didn't because they couldn't get out of the house. Now that's actually going to have an impact on the rates of oncology cases. So we're thinking about primary care first and foremost, like what's the most important thing? Then it's going to be behavioral health, sustaining people where they are in a different situation. And then it's the management of the chronic care and how that's going to change. So those are like the 3 platforms that we're looking to integrate with Sydney Care, which is our telehealth front door. And then also I'm actively looking to bring in technologies that are going to support that. So what is the person with COPD doing? What's the heart failure needs and that kind of stuff. So those are the tiers at the moment.
Yeah, and I'm assuming that as part of kind of the machine learning, AI, we're taking into account some of the areas within specific geographies that either struggle with transportation, there's access problems and so forth, and being able to kind of incorporate that and educate the members to what options are available and how to manage their health virtually.
Yep, they're actually one of the things that, COVID's been interesting, but many good things have actually come out of it. And I think one is the quickly development of technology, where we developed a program where a provider and patients could go and see where the pharmacies or the testing diagnostic plates are immediately available for them. And if they can't get out, what is the home testing and diagnostic services that we're providing through our telehealth to actually get the test straight to them so they don't even need to leave. So we are looking at things like that as well. And it's been sort of the need has driven the innovation, whether you like it or not. And now you can even you can actually find maps through Anthem to tell you sort of where the closest provider is. That you could do that before, but it's like instant in like real time now. That wasn't so available before. Yeah. What are the, I was curious sort of, as we sort of look towards the future, I've just mentioned sort of the primary behavioral health, the chronic care. Is there anything that I haven't mentioned, maybe particularly when it comes to working with sort of the institutions and the providers in your region? Because I'm very like virtually focused, but at some point, obviously Anthem still needs to support and work with our providers in the facilities.
Yeah, you know, I think that we still have a fair amount to go with even there's the simple coordination of getting people into doctor's visits or scheduling a surgery and so forth. Like, so how do we make that experience as simple as possible? And part of it comes back to our front door experience, right? Education, the ability to coordinate care. It's my strong preference that our membership interacts with Sydney, our app, or some other mechanism to, number one, understand their benefits, right? And I think a lot of people probably aren't quite as aware that based on who your employer is, your benefits can be wildly different, right? And not just in terms of copay, deductibles, coinsurance, but in terms of coverage, how it's coverage, limits, and so forth. Now, the Affordable Care Act certainly did a great job in terms of, you know, bringing it more towards the mean, but there's still a tremendous amount of variation out there. So the ability for somebody to come in, understand their benefits before care is needed, make an appointment, potentially even not have to go to the physician's office and fill out the same 20 forms every time you show up, regardless of where you go, and then being able to have their visit and understand what that will cost them and how that works ahead of time, and then to have that transaction simplified. To me, that seems like something we should already have solved for. But again, if you think about it, we have hundreds of hospitals just in New York, thousands across the country, you know, tens, hundreds of thousands of physicians that all have the subtle differences in both their technology and how we operate. And so for me, I think one of the missing pieces, and it comes back to interoperability, is how do we make sure that is coordinated, right? And then if we can then also coordinate the EHR, utilization management, the care management, and so forth, and then get to this point where you have that, not just interoperability, but inter-information exchange. So that if somebody does have an unscheduled issue, we don't have to ask all the questions. It's already there. What drugs they're on, you know, what did they recently have? Did they recently have a behavioral health issue, an addiction issue, whatever it is, and we can then coordinate that care. I still think we're quite some distance away from that.
Yeah, I would. I won't disagree. Like I do agree with you that it's something you should expect should be done. Like, so we have Sydney Health, which will tell you what your employer covers and your number that you need to use when you fill out those awful forms, and then you've got Sydney Care, which is the front door bit. Wouldn't it be great if they were together right now? Now we do have plans to make that so that you automatically might have not just your physician, but maybe your dentist reaches out to you and says, yeah, by the way, you haven't had this done in so long. These are the available times. Which one works for you? And even if you take that step further, like in Dreamland, what if it actually had appropriate access to your calendar and could actually suggest, I know you're going to be free here. Oh, and by the way, I also know your daughter's got a karate thing, and that would actually work. Like, it sounds crazy, but those are the barriers to care, people's busy lives, and that just practical information exchange between the provider and the patient. So to me, that's where it would be great to get to first. And because that actually gets people through the door, and then just as you say, that's when you can kind of like communicate what's actually happened to them, about their medications, and that could all be help you plan the next visit. Like if you know you've got a med that's going to run out at a certain time, but you can't give another script because they need to be checked first, that all gets built in. So we are working there, not there yet, but very important to get that done. And lest we forget, like we're Anthem, we have Sydney, but there are many providers working with many other systems, and we shouldn't be making it harder for them. So we need to come up with some sort of, the dreaded wraparound tool that works for everybody. But still trying to.
Kate, I think it's also a great opportunity for, whether it's startups or the beginning of other entities out there in the technology space. I think, not to put words in your mouth, we'd agree we're not going to solve this puzzle unto ourselves, neither are provider pack partners. But where is there opportunity? This interoperability, the ability, for us to integrate with, whether it's your calendar or understanding what, from your geolocation, what you tend to do on a Thursday, and yes, you have more availability there. To me, that's a real opportunity. And I'm sure we would love to partner with entities out there that are thinking along those lines too.
Yeah, so from the, I mentioned that sort of I lead the Anthem Digital Incubator, and what we're looking to do there is bring sort of outsiders who know healthcare just as well as us. Perhaps they're more familiar with some of the problems, and they want to bring in their technology and actually learn with us, like, what does it mean for the Anthem population? And by spending some time in the incubator with us, sort of being educated, getting funding, and having like the appropriate mentorship, we're hoping that some of those tools will come to reality in a very quick turnaround time, like less than 6 months, and see that it can be plugged into the market. Because I think we are humble enough to know we don't have all the answers, and sometimes it means going outside and asking people to bring their expertise in. We actually have an entrepreneur in residence program where we have people who've been sort of experienced consultants in the world, and we have them come and live with us for like 6 months. It's a bit like the year-older child that won't leave. They come live with us for a little bit. They kind of understand what's going on within our company, and then they actually build something from scratch for us to sort of roll it out through the incubator. So we are looking to do it in various ways to meet the changing need. That's one thing that's keeping me busy at the moment, is as well as thinking about telehealth virtual strategy.
Okay, could I trouble you maybe to take that a step kind of further? If there was like when you were talking earlier about kind of the calendar and so forth, I would refer to that as the Disney theory, right? You come up with the greatest concept possible. You don't put any of the caveats in or any of the problems. You do that at the second stage. If you were going to Disney theory the incubator, how would you see it from start to finish? A budding company with a great idea. How do you see them starting and getting through, and perhaps going from there?
So I love Disney, have annual passes with my family. It's closed at the moment, which is a bit of a bummer. But if I was to have my incubator be such a wonderful place, I'm also a bit of a realist. I love sort of the Disney fantasy, but the reality of healthcare is that you need a solid business case. And often you might see with incubators that companies come in with this wonderful solution, but you don't actually have a problem for it to fix, or you go searching for one, which is the worst thing ever, because you're trying to like retrofit this solution to the problem that's never really there. So in the Disney version of our incubator, it would be based very much upon what is the need of the business, and that's actually what we're doing. We're making sure that all the different lines of business, whether it's partners such as yourself actually out in the regions, or whether it's working with our Medicaid team or our Medicare group, like, what is it that I like to say keeps them up at night? What is the thing that's actually stopping a patient getting care? It could be something mundane as they didn't get their card in time, or they don't even know where to find their membership number. It can be something as small as that, or it could be something along the lines of, what's the new virtual health technology for COPD, which I wish they could have in their home, which is going to stop them being rehospitalized. So for the incubator, it's coming up first and foremost with the right business case, bringing in the best and the brightest to solve the problem, and then making sure that they understand, the entrepreneurs that come in and work with us, the intricacies of the healthcare system and the regulations. I think there's a wonderful bevy of technology out there at the moment, technologists that maybe have never worked in healthcare before, and it seems really simple. And it's not until you get into healthcare you realize how complicated it is. It's not, there's a lot more to it, I think, than people assume. So I think when they come and join our incubator, it's about making sure that they understand the intricacies and they get someone to kind of like hold their hand through the process. The quickest way to get a meaningful technology out into the market is having a really smart person with the technology and someone holding their hand who really understands what the business is like. So that is what my Disney version of the incubator is going to be looking at. And we're so at least in the region that you're in, we're actually opening up a bricks and mortar version of this on the West Coast in Palo Alto, where I am right now. But then we will actually be looking to open one in Manhattan. So watch this space. There could be one coming soon, and it would be great, I think, to actually have some of those entrepreneurs actually get to spend time with maybe you and your colleagues and hear what the problem is, and they can take that back to the drawing board and design something from scratch.
That's awesome.
So the use of virtual care, it's not just about concentrating on what the patient thinks. Like, the provider is just as much in need there and it's our role to make sure that sort of the digital gets implemented appropriately, and overall we're decreasing the cost and sort of decreasing the barriers to access to care as well. So I've very much enjoyed chatting with you about all these different things. I think we've kind of like covered the gamut, and do very much appreciate you sort of making the time today and having the conversation with me.
Okay, it's been a real pleasure.